Bismillahirrahmanirrahim. Quote of the day: housing is absolutely essential to human flourishing. Without stable shelter, it all falls apart. Today, the topic of my presentation is Healthful Housing, lecture number 212, under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is introduction, need of housing, standards of housing, effect of poor housing, recent updates, and at the end, MCQ session. In the end of this presentation, participants will be able to understand housing, need of housing, standard of housing, and recent updates. Define housing. The term shelter, which is often used to define housing, has a strong connection to the ultimate purpose of housing throughout the world. The mental image of a shelter is of a safe, secure place that provides both privacy and protection from the elements and the temperature extremes of the outside world. Why there is a need of housing? Housing is need due to different fundamental needs like physiological needs, psychological needs, protection against diseases, protection against injury, fire and electric shock, protection against toxic and explosive gases of external environment. What is physiological need? In physiological need, there are many requirements of human can fulfill, like protection from the elements, which is hazardous, thermal environment that will avoid undue heat loss, thermal environment that will permit adequate heat loss from the body, an atmosphere of reasonable chemical purity, adequate daylight illumination, and avoidance of undue daylight glare, protection from excessive noise, adequate space for exercise and for children to play. Psychological needs that are fulfilled in a healthy house are adequate privacy for the individual, opportunities for normal family life, opportunities for normal community life, facilities that make possible the performance of household tasks without undue physical and mental fatigue, facilities for maintenance of cleanliness of the dwelling and the person, possibilities of aesthetic satisfaction in the home and its surrounding, concordance with prevailing social standards of the local community. There are many historic perspectives of a modern housing. In the early 80s, the relation between housing condition and health was recognized among public health practitioners in the United States and Europe and led to rise of the sanitary reform movement. Industrialization caused a rapid growth in urban population that was not matched by a sufficient increase in adequate housing. Builders eager to capitalize on the need for housing built inferior housing in congested areas of cities. Until recently, most people in the West felt their homes were much healthier than in the past, and that this had been achieved by modern technology. But we are now facing problems like puzzling sick building syndrome, badly polluted air, drinking water, chemical vapors, and synthetic building materials, fields from electrical supply and appliances all make us worried about just how healthy our houses really are. Now, what is sick building syndrome? The feeling of illness among majority of occupants of a conditioned space. Sick building syndrome basically it occur on that people which are working in that environment where there is no provision of natural light. All air is artificial by air conditioning system. Symptoms reported by occupants are headache, fatigue, irritation in eyes, nose and throat, shortness of breath. Now we come towards housing standards. There are different international housing standards which are required when you construct a healthy house. Housing standards depend upon conventional factors such as per capita space and floor space and on social and economic characteristics such as family income, family size and composition, standards of living, lifestyle, and different stages in life cycle. Despite the cultural climate and social diversities, housing standards vary from country to country, region to region, but the minimum standards are still maintained by all countries' building regulation. What is site? The site is very much important during the construction of house. It should be elevated from the floor and prevented from floods. It should be accessible, away from vector breeding places, away from nuisance such as dust, smoke, and stink. The soil should be dry and safe, and the surrounding of the house are pleasant. Setback. Now, what is setback? This is an open space around the houses. There should be adequate space all around for light and ventilation. Build-up area should not be more than 1/3 of the total area in rural housing, and in urban area, this may be compromised to 2/3 due to cost of land. Floor. Floor should be impermeable, smooth, and free from crack surfaces, and it is damp proof. Walls should be reasonably strong, should not absorb or conduct heat, weather resistant, not easily damaged, smooth, unsuitable for rat, and not easily damaged by different type of insects or animals. Roof. The height of the roof should not be less than 3 meters, almost 10 feet, for a better cross ventilation of air. Rooms. Number of living rooms should not be less than 2. The number and area of rooms should be increased according to the size of the family, and the uh, daylight factor which is provided in a living room, it should be 8%. Floor area. Floor area of a room should be at least 120 square feet for occupancy by more than one person, and at least 100 square feet for occupancy by a single person. The floor area available in living room per person should not be less than 50 square feet, and the optimum area is 100 square feet for a normal person. Windows. Every living room should be provided with at least 2 windows for a better ventilation. Windows should be placed at a height of not more than 3 feet above the ground in the living rooms. Window area should be 1/5 of the floor area. Doors and windows combined should have 2/5 of the floor area. Kitchen. Every dwelling house must have a separate kitchen. It must be protected against dust and smoke, adequately lighted, water supply, and a proper sink for washing the dishes, floor impermeable for easy cleaning, and the daylight factor in a kitchen is 10%. There are different other essentials in the house which are required, like privy, which is also called a toilet. A sanitary privy is a must in every house belonging exclusively to it and readily accessible. Garbage and refuse. Daily basis garbage and refuse should be removed from the dwelling at least daily and disposed in a sanitary manner. The water supply of a houses have adequate and safe, and it supply almost all times. Cowshed, if there is any cowshed is in the house, it should be separate from the house and almost at 20 feet distance from the house. So now, what is overcrowding? Overcrowding is refers to the situation in which more people are living within a single dwelling than there is a space for, so that movement is restricted, privacy secured, hygiene impossible, rest and sleep is difficult. So there are different recommendations uh, For the rooms, every living room should have a almost 2 person, and 2 rooms is for 3 person, 3 rooms for a 5 person, 4 rooms almost for the 7 person, and five or more rooms is recommended for 10 person. Health is affected by prominent dimension of housing like stability, quality and safety, affordability, accessibility, and neighborhood environment. There are different effects of poor housing, like respiratory infection. If house is overly crowded, then there is a chance of respiratory infection should be more, like common cold, tuberculosis, influenza, diphtheria, bronchitis, measles, and whooping cough. Skin infection are also common, scabies, ringworm, impetigo, and leprosy. And if there is a presence of rat in the house, then there is a chance of infection like plague, arthropods like fleas, mosquitoes are responsible for the typhoid fever, diarrhea, vomiting, and malaria. And if the building structure of house are not adequate, then there is a chance of accidents like orthopedic injuries, electric shock, and the uh, burning due to any firearm. Recent updates. There are different facts and figures from the world due to poor housing. Health condition related to housing present an important health burden. Some of this attributable to poor access to water and poor indoor environment, quality water sanitation and hygiene. WASH were responsible for almost 82,900 deaths from diarrheal disease worldwide in 2016. This constitutes 1.9% of the global burden of disease. In 2016, 3.8 million deaths globally were attributable to household air pollution from the use of solid fuels for cooking, almost in which occurred in low and middle income countries. About 15% of new childhood asthma in Europe can be attributed to indoor dampness, representing over 69,000 potentially avoidable delays and 103 potentially avoidable deaths every year. Housing also contribute to the burden of disease through exposing people to dangerous substances or hazards or to infectious disease. For example, about 110,000 people die every year in Europe as a result of injuries at home or during leisure activities, and a further 32 million require hospital admission because of such injuries. In Kyrgyzstan, household crowding caused 18.13 deaths per thousand from tuberculosis per year. Exposure to lead is estimated to have caused 85,300 deaths in 2013. So these figures represent the burden of disease due to poor housing. What are WHO new guidelines for housing? In these guidelines, there is a presence of summaries of existing WHO guidelines like water quality, outdoor air quality, indoor air quality related to indoor fuel and other pollutants, dampness, mold and radon, neighborhood noise, asbestos, and lead. And the new recommendation which are included in these guidelines are inadequate living space like overcrowding, low indoor temperature, high indoor temperature, injury hazards in home, accessibility of housing for people with functional impairment, and proximity of housing to walking and cycling infrastructure. This is one of the articles which shown the importance of housing and cardiovascular health and well-being, a scientific statement from the American Heart Association. The abstract of this article shown, housing is a prominent social determinant of cardiovascular health and well-being. It should be considered in evaluation of preventive efforts to reduce risk of cardiovascular disease. Now it's the time for MCQs. Aslam 29-year-old, Akram 32 years old, Khalida age 30 years are residing in a house with a kid of 6 months. The house comprises of 3 well-ventilated rooms. How many person can reside in this house?
C.
D.
D, 5% is the correct answer. An outbreak of scabies reported in XYZ area where houses are small and overly crowded. Government water supply provide water to that area. The appropriate preventive measure suggested by you would be filter the water, chlorinate the water, improve accessibility of water, avoid walking barefoot.
C.
C is the right answer. Improve accessibility of water because there is an outbreak of scabies reported in that area. MCQ number 3. While visiting rural houses in nearby village, a sanitary inspector reports that most houses are not confirming the sanitary and health standard, especially maintaining the distance between residential area and cattle shed, which should be at least 20 feet, 25 feet, 30 feet, or 35 feet.
B.
25 feet.
B is the right answer, 25 feet. For the construction of houses, there is mandatory to follow some standards. Which of the following statement regarding healthful houses is not correct? It should be elevated from surrounding. Site should be in pleasing surroundings. It is ideal to construct house in made soil. Should have an independent access to street of adequate width.
C.
C is the right answer. It is ideal to construct house in made soil. Made soil is basically a soil which is artificially made from the garbage or refuse, or so it is not ideal to construct the house in made soil. Daylight factor is the ratio of illumination at given point indoors to illumination at a point outdoor exposed to the whole hemisphere of sky expressed as a percentage. What is the daylight factor recommended for living room? 2%, 4%, 6%, or 8%?
D.
8%.
D is the right answer. The daylight factor recommended for living room is 8%. Constructed area should be 2/3 in urban areas and 1/3 in rural areas. The mandatory open area around a healthful house is termed as corridor, passage, ground, or setback.
D.
Setback is the right answer, D. Daylight factor is the ratio of illumination at given point indoors to illumination at a point outdoor exposed to the whole hemisphere of the sky expressed as a percentage. What is the daylight factor recommended for kitchen? 4%, 6%, 8%, or 10%?
D, 10%.
10%.
10%. Daylight factor recommended for kitchen is 10% and daylight factor recommended for living room is 8%. The engineer design house wanted to make sure that floor space requirement per person must be according to laid down standards of good housing. The minimum floor space required per person is 20 square feet, 30 square feet, 40 square feet, or 50 square feet.
D.
The minimum floor space. The minimum floor space required per person is 50 square feet and a maximum floor space which is required per person is 100 square feet. There is centrally air conditioning system is used for cooling and exhaust air to outside. The most effective ventilation system for house is open window, ventilation fans in kitchen, ceiling fans, and exhaust fans in living room.
E.
Open window A is the right answer. Medical condition that affect people who works in that type of place where air is not healthy or natural. Which condition is highlighted in statement? Sick building syndrome, heat exhaustion, heat syncope, or dizziness?
A.
A. Sick building syndrome. This is the key of MCQs, references of my presentation, and thank you.